Just started. We're pretty much in some places in just the first week, and we are now hearing that in a Mississippi school district, the Corinth School District, now reporting that there have been several people who have tested positive for the coronavirus, and that has caused 100 students to have to be quarantined because of those positive tests. And this as the president has been saying that schools must reopen.
The virus is winning and the American people are losing.
The coronavirus teaching us a terrible lesson as some schools begin filling with students. In-person learning already disrupted in Cherokee County, Georgia, after a second-grade student tested positive within the first couple of days. Students and a teacher in that class now home for a 14-day quarantine. In Georgia's largest school system, 260 school employees staying home due to positive test or exposure to the virus.
This is a community issue, and we need to find a way to be able to get through to the higher ups and help them see that if the teachers aren't safe, then the students aren't safe, and then the community is not safe.
In Mississippi, some schools reopening, even though the state has the highest positivity rate in the country. Masks now mandatory, including in schools located in COVID-19 hotspots. Dr. Anthony Fauci says if in-person learning happens, one way to mitigate the danger?
Keep the windows open. That, to me, when you're dealing with a respiratory virus, its simplicity is so obvious.
But in the third largest school district in the country, public school officials announcing the danger is too high to reopen.
The fact of the matter is we are seeing an increase in cases. Combined with the trends that we're seeing, the decision to start remotely makes sense for a district of CPS's size and diversity.
An American Academy of Pediatrics study revealing minority children had much greater rates of infections than their white counterparts. In a study of 1,000 children, 30% of black children and 46.4% of Hispanic children tested positive for the virus, compared to 7.3% of white children. Across the country, a small bit of hope. 45 of 50 states are seeing new case rates steadying or declining. But the death toll is still rising. Nearly 1,400 people reported dead in one day. Dr. Anthony Fauci says the lack of a uniform reopening plan helped create a surge in cases, which in turn led to more deaths.
When you look at the number of infections and the number of deaths, it really is quite concerning. I mean, the numbers don't lie.
New York City's mayor announcing vehicle quarantine checkpoints after numbers show 20% of all new COVID-19 cases in the city are coming from out-of-state travelers.
The checkpoints, I think, are going to send a very powerful message that this quarantine law is serious.
In Jackson, Mississippi, a different move to try and slow the spread, a nightly curfew for a 5-day period announced by its mayor.
Look at this case in Georgia, Sanjay. That second grader who tested positive is now home quarantining for 14 days. The classmates and the teacher had to quarantine at that particular school, that class, but the whole school didn't close. What do you think about that? What do you think the procedure should be here if someone tests positive in a school? Should everyone be sent home or just the classroom?
Well, there is no national or even state policy on this sort of thing. So these are handled on a case-by-case basis, which, Pamela, as you might imagine, may start to become there may start to be a lot of these types of cases. Local
right,
health
because it's
officials
just
get called in.
beginning. I mean, schools are just starting to open, and now we're already seeing this play out.
And you add into that people are often most contagious before they develop any symptoms, if they do. So what the local health officials have to do then is they have to essentially figure out who was in close contact with somebody. Were they within a certain distance? How long were they within that distance? What sort of contact did they have? It's laborious work, and you're going to have to do this in each school district each time this occurs. So the answer in this particular situation may be based on the fact that there was lots of contact. The second grader, other students, and the teacher, they decided to put the people in quarantine and the infected child into isolation. It may be a different situation in a different school. Some schools are doing what is called cohorting, Pamela, where basically you have the same few people that you are essentially with in a bubble, or a sort of bubble, throughout the day in a school district. So if one of those people subsequently tests positive, then it'll be the smaller cohort as opposed to the larger class or the larger school. But again, it strikes me, because I've been having so many conversations with school administrators, that everyone is sort of coming up with their own plan. Even in my own kids' school, the plans are changing even today in anticipation for a couple weeks from now.
Yes. So do you think then there should be a national policy, a one-size-fits-all template for schools to reopen safely, or do you think this, as you just pointed out, schools kind of doing it their own way is a good way to go about this?
No, I think it's confusing for people. It's confusing for the administrators. I mean, as we talked about yesterday, everyone is sort of becoming forced to become these amateur epidemiologists, right? Just try and piece this together. And school districts and school superintendents have a tough job right now, and parents are obviously concerned. I think when it comes to the basics, those things can be uniformly applied. And you know what the basics are at this point, but maintaining some sort of physical distance, face masks within schools, having proper ventilation, even opening windows, things like that, limiting communal spaces. There's a whole list of things which are the basic things that should be applied across all school districts. But a big thing that is not on here, and the CDC is not universally recommending, but some school districts are starting to, is testing. Testing students before they come on campus and having some plan for regular testing every several days or a couple of weeks, whatever it might be. Most school districts don't have it, don't have the capacity for it, don't have the money for it, and that's a problem.
Yeah, I was actually going to ask you that because you were talking to Dr. Fauci today, and he said, look, testing across the country, I believe his words were unacceptable, right? He said the current situation is unacceptable. You look at that school in Georgia, it seems as though the results came back quickly for this student, but that's not what we're seeing across the board. I mean, some people are having to wait several days, even weeks to get results back. So how does that play into all of this with schools reopening?
Unless you get the test results back quickly, it really, from a public health standpoint, loses its value. The reason you're testing from a public health standpoint is to quickly identify people who are carrying the virus and being able to isolate them to slow down the spread. If it's taken too long, people can go out there and still be spreading. As you know, I mean, many people might not have any symptoms, so they wouldn't even know that they were spreading. So it's almost useless if it's taking too long, over a few days. There's also, on top of that, Pamela, almost a larger problem, which is we still don't have enough tests. We're trying to test in a surge capacity sort of way in hotspots. The idea of what we talked about yesterday, assurance testing. Pamela, if I were to see you, visit you and your family, your two beautiful children, would you have some assurance that I didn't have the virus? Could I have assurance that your family didn't have the virus? We're not anywhere close to assurance testing at all at this point. So it sounds like a fantasy almost. But to be able to get to that point it could be very helpful with trying to open schools. Lots of kids indoors, possibly close contact, tough situation otherwise.
Do you feel like we have any sort of answer as to why we don't have that yet 6 months in to this pandemic? That still doesn't exist on a wide scale. Why?
Yeah, I asked Dr. Fauci this today as well, Pamela, and it's been a constant source of frustration. As you mentioned, he said it's unacceptable, period. That was his quote. I don't know, Pamela. I mean, this is going to be an interesting retrospective at some point. No point throughout this entire thing, since February, since late January, have we been on the ball with regard to testing. We've been behind from the very beginning, and we're still definitively not caught up right now. We needed major breakthroughs in testing back, several months ago. We're not there. Yeah. I don't know. I mean, some have suggested that we have tried to minimize this problem by not testing enough. You've certainly heard that. Whatever the motivation, we're paying for it now with things like schools and starting to try and reopen things.
And it's interesting, when the president talks about the virus, he often brings up treatment and how the vaccine, is being developed in rapid speed. We don't hear a lot from him, though, on testing, making the testing kits more available, widely available, the quick response kits and so forth. He doesn't talk about that as much as the treatments and vaccines. And something else he said that was interesting to me, Sanjay, he said it this morning, was school-age children are essentially immune from coronavirus. Let's take a listen.
If you look at children are almost, and I would almost say definitely, but almost immune from this disease. So few, they've got stronger, hard to believe, I don't know how you feel about it, but they have much stronger immune systems than we do somehow for this. And they do it, they don't have a problem. They just don't have a problem.
Does the data back that up?
The data does not back that up. I mean, I think that he doesn't know what the word immune means, frankly. I mean, you know, kids can become infected with this virus. They can carry this virus in their bodies. It is true they are less likely to get sick. But keep in mind, what we're talking about here is a pandemic, an outbreak of infectious disease. So in addition to thinking about people getting sick and obviously taking care of them, you're trying to slow down the spread of this disease. What we know now from a big study that came out of South Korea, kids 10 and older, they're not immune, first of all. They can carry the virus, and they spread it just like adults. Kids younger than 10, we still don't have enough data to really know, but they carry a lot of virus in their bodies, so they're not immune. Also, if I can just say, with regard to testing, because you brought that up, the president has said that he wished there would be less testing. If he's weighed in on that topic at all, that's generally been his about it.